Hi, I'm Nikki, and I am the creative director of Transform Nursing, and I am super excited that you're joining me for this masterclass. This is going to be a really great experience. I hope that you enjoy it. Let's go ahead and get started. Welcome to Leadership Practices for Nurses Who Want to Make a Social Impact. Again, my name is Nikki Akparawa, and I am the creative director of Transform Nursing, and I am super excited that you're here in this masterclass with me. Before we get started, I just want to encourage you to take that one extra moment to get as focused as you possibly can. So turn off your phone, close your door, shut down anything else that's running. I know it's super hard to ask that of you, but please do that so that you can take this next 45 minutes and get the most that you possibly can. If that means getting your patient off the bedpan, please do it as well, or put them on the bedpan, all right? We just want you to be focused so that you can be fully present and learn and be as engaged as possible. My hope is by the end of this masterclass that you're going to discover how social impact is a huge component of inclusive leadership. I want you to understand how inclusive leadership is the best approach to change poor performing work environments. We are going to walk away with tools for inclusive leadership and going to begin to think about intersections between bias and health. This leadership masterclass is not just for anyone. It really is for the nurse who wants to make a 5-star impact on patient health and outcomes. It's for the nurse who needs strategies that create inclusive and influential leadership and motivate team building. And it's for nurses who want a non-traditional leadership training approach. Now, you can take all kinds of traditional leadership and management trainings that will really focus more on certain standards and maybe focus more on budget and operations, may even go into more detail about how to supervise folk. This type of leadership masterclass training is really more about influential and inclusive leadership, aspects that you probably didn't learn about in nursing school because they just weren't part of the curriculum. My very first question to you, and I want you to be engaged, so I'll ask questions throughout this masterclass, is do you believe that nurses struggle as influential leaders? And what is an influential leader? Well, when I think about influential leaders, I'm thinking about people who have the ability to make decisions and for people to listen and be guided by the recommendations of that person. And it's not to say that nurses cannot or don't often act as influential leaders. It's just that we don't necessarily have the training to do so. And so for the most part, I think that nurses struggle to step into the full light and own the fact that we are here to advocate for our patients, not just on the level of one-to-one, but on the level of health policy, on the levels of strategic planning and governance, on various levels, and we are there to help guide our organizations towards better quality improvement, and that includes our social impact strategy. So what is social impact? Well, social impact is the effect an organization's actions have on the well-being of the community. And social impact is growing widely in so many different ways. I can see it when I look at commercials. I looked at a commercial the other day for Wharton University, and they were talking about their social impact and what they are doing for the community. And I'm seeing it more and more in our nursing schools, how they're trying to connect the work that we're doing inside of our walls to the community, and hospitals are starting to do the same thing. So we can start to say that social impact is growing. It's coming up more and more in dominant culture. It's going to remain on the agenda. Let's learn the skills now to really have good skills to talk about and work with social impact. And these are more examples of how social impact is growing with shows like Explained, where they have these great documentaries. And one of my favorite ones that they've done is The Racial Wealth Gap, to really give us a clearer picture of how social aspects and class really do impact the health and the wealth of populations differently. Blackish, a show that's talking about a suburban Black family that's really kind of trying to figure out how to fit in and acculturate. Or Dear White People, a show that is really trying to help white folk understand some of the context and the things that Black folk may be going through. And Insecure, same type of concept where we're really looking at what is this community organization, the We Got Y'all community organization, doing to really impact this community that we're serving. And can we say that as nurses, for the patients that come into our institutions, can we say with honest truth that we are doing everything that we can do to make sure that we are affecting social impact, or that we are having an impact on the well-being of that person's community and not just on the individual that we serve. That's what we're trying to do. Social impact is really about social justice, and social justice is about proactive reinforcement of policies, practices, attitudes, and actions that produce equitable power, access, opportunities, treatment, and impacts for all. So social justice above and beyond is proactive, and it goes hand in hand with social impact, with the effect that we want to have on the well-being of the communities that we serve. But before we continue, I want to share a little bit about myself and my story. I've been a nurse for about 13 years now. I have loved almost every bit of it, the good years and the bad years alike. And what I have learned in my life is that much silence makes a powerful noise. And what this is saying to me is that for so many years, when I first started as a nurse and just being a Black woman in America, it can be really difficult to know what to talk about and what not to talk about, right? Because race is just so tense. People don't want to talk about it, yet we're dealing every day with people of different races and cultures and class, and we are always going to be grappling with inclusion and influential leadership for these people. And so I started to see that my silence was really making a powerful noise inside of me, because I could no longer repress and deny that I had felt that bias had happened against me and my family because of the color of my skin when I've been in these systems. So this is personal for me. So I showed a picture of my family, my husband and my son. His name is Gabriel. And Gabriel, we call him GJ, when he was 3 weeks old, was diagnosed with sickle cell. And as a result of that, providers recommended that my son take penicillin for the first 5 years of his life, just in case he developed a severe bacterial infection. And what I knew about antibiotics is that they can wipe out the good, healthy flora in the gut. And I was very concerned that my child was not going to develop a healthy immune system if for the first 5 years of his development, we were giving him a medication that was going to compromise it. Not to even go into the fact that sickle cell has been around for many, many years, and it's predominantly considered a, quote, Black person's disease. And there has been very little research that's really been done, and even less is known about what kinds of treatment options that we have out there. The one treatment option that's been around for the past 30 years is hydroxyurea, which is a cancer drug, and it's the only drug that we have really to help manage pain and crises. And that has caused me a lot of different discontent. But in general, when it came to Gabriel, and I told his provider, his pediatric hematologist, that we were taking him off of the penicillin, his doctor was so upset at me that he told me that if my son had the SS version of this disease, that he would have sued me for medical custody. The doctor was telling me that he was going to take my child away from me because he didn't think that I knew what I was doing. How offensive it was to me. And I was silent in that moment. I didn't know what to say. What words do you have when a provider has such trained arrogance that even though he knew that I was a nurse, even though he knew that I was seeking other modalities, he still had the audacity to say that to me? And I began to wonder, what about those people who don't have anybody to advocate for them, who don't have the skill sets, and who have providers who are displaying really insensitive behaviors or saying things that are insensitive, or even having passive aggressive or nonverbal expressions that they just do not really care about what's going on with these patients. And it led me to think, this is a story that I can no longer be silent about. And that's where Transform Nursing was born. So my next question that I want to ask of you is, what do you believe is the best way to teach nurses and other healthcare providers about the impact of race and class on health? So I want you to take a moment, and I want you to try and answer this question for me. All right, great. So Shannon has said, just learning about the culture and how to interact with the different races will help us. Good. Thank you, Shannon. Malik said, look at the practical application of healthcare by looking at preventive care, who participates in it and who doesn't and why, medication compliance, follow-up care, its cultural heritage, economic lack resources or geographic location that prevent people from participating in preventive care. Thanks so much for that, Malik. And we have Alicia who says, Hold continuous classes on these areas. One class a year cannot bridge the gap. Nursing is a career that is forever changing every day. Medicine in a whole is changing every day. Thanks, Alicia. It truly is. Jean says statistics and facts. Yes, Jean, that's very true. It's very important to have statistics and facts. And Liz says, I wish I knew the right answer to this question. I think small groups where people can engage, not hide behind their phones, with a trained facilitator is probably the best. Multimedia, books, blogs, videos, plus class discussions, and a good mix. And probably building a foundation of knowledge of race and class issues in America for folks who maybe didn't have that education growing up so they can participate effectively in conversations and not feel behind. Wow, what amazingly responsive responses. Thank you so much for sharing those. Please continue to pour your responses in. I would love to hear your feedback. I love listening to what you think is important because all of this helps shape the work that I'm doing inside of the Nurses Influential Leadership Lab. So Transform Nursing desires to have social impact. And like I said before, social impact is the effect an organization's actions have on the well-being of the community. And so my goal in Transform Nursing is to have many different levels of social impact on the nursing community that I serve, as well as for marginalized and oppressed groups and populations. So social impact comes in the form for me of education and awareness through podcasts and blogs. You can check out my website at Transform Nursing to see some of the podcasts that I have. Community building in the respect of having workshops where I bring people together that are clinicians and healthcare providers and community members and lay leaders and activists, and we dialogue. We have deliberative dialogue about what needs to happen. How do we increase cultural sensitivity? How do we bring in social impact? Executive and group coaching is very, very critical to really making this a sustainable part of a social impact effort, because social impact is really about building this into organizational structure. So I provide that executive and group coaching. Mindfulness work is also really critical when you're doing work that engages such creative tension and that tends to bring up discomfort for so many people. And intentional and inclusive leadership training, which is the training that I offer. And the training that I offer is called the Nurses Influential Leadership Lab. And this course is so unique because it's the only social justice course online that I know of specifically for nurses that is allowing you to have these deep and honest conversations about race and class and health and really get to a place where you feel like you can engage in inclusive leadership. So now I want you to pause and I want you to think about a time when you really felt like you were excluded from a practice, or you felt like you had a patient that you just didn't understand, whether it was because they spoke a different language or they had a different cultural practice, or a time when you felt like you were sort of left out of a nursing conversation and there was sort of a clique going on, or a time when you just felt like you were isolated and just didn't understand. Maybe you were a new nurse. Maybe you just didn't know fully what to do. Think about the emotions that go with that. Think about the shame or the fear or the guilt that you feel, or just feeling confused about what you should do next. And then I want you to think about some of your patients that you may not even know of feel like that all the time in your presence, and they may not even tell you. Think about the interactions that may have happened with those patients that they didn't even say anything to you about. And I want you to take that and I want you to understand that exclusion is really, really powerful. And cultures of exclusions actually cost us all. 75% of people voluntarily leaving jobs don't quit their jobs, they quit their bosses. And hospitals lose anywhere from $5 to $8 million annually on nurse turnover, and the rate is said to be increasing. And that baffles me that we are increasingly having more nurse turnover. Workplace bullying or lateral violence seems to be remaining prevalent in nursing. Greater than 90% of nurses have said that they have witnessed lateral violence or even been a victim of workplace bullying. And what I want you to understand is when workplace bullying occurs, it's not just occurring between nurses and nurses or nurses and doctors. This type of behavior is also occurring between nurses and patients. And we are losing out, and it is costing our organizations and the communities that we're serving. The vision of Transform Nursing is to promote sustained behavior change through the use of varied influential leadership metrics that will create more inclusive cultures in work and community spaces. We know that nurses need to feel safe in the places that they practice. They need to feel safe in taking care of their patients. They need to feel supported by their managers and by the leadership structures. And when we have staff splitting, when morale is low, then we know that it requires lots of different influential tactics to get nurses more engaged in the work that they're doing and to bring social impact into the work that we're doing so that our patients are not suffering as a result of poor performing workplaces. And I've had the opportunity to partner with several different organizations in many different ways. Many of them have been nursing organizations, but I've also partnered with Trinidad and Tobago Ministry of Health, with the National Wellness Institute, with community-based organizations, with other universities. I've had the opportunity to travel and to speak to different people. So I've had the experience of helping many different types of organizations build and develop social impact initiatives. Some of the successes that I've experienced have really been really great feelings to me, to just know that I've been able to help people. And one of my favorite successes is that I earned a position as the Director of Nurse Education for Trinidad and Tobago, implementing over 9 independent programs. I secured a $42,000 contract for inclusive leadership training for Trinidad and Tobago nurses, and it was actually housed at the Johns Hopkins Hospital, and that was over the period of about 3 months. So what nurses make in about a year, I made in about 3 months. And I was sought out to keynote for a $5,000 speaking engagement for inclusive practices in workspaces, where I helped this organization really have a better understanding of how they could really bring inclusive leadership into their workspaces. What I want to know from you is, are you excited to finally learn skills that it takes to get teams engaged and systems to change? Well, if you are, let's take this next step. If you need to learn how to be a leader that others want to follow, then Transform Nursing provides more connection and mentorship in a peer networking environment focused on influential leadership. And the influential leadership tactics and strategies that I'm using are from multidisciplinary approaches. So coming from nursing, from medicine, from business, from substance use training, from harm reduction strategies. It's coming from a variety of places. If you need the leadership skills to confront systems that are exclusionary, Transform Nursing provides an inclusive leadership model that focuses on multi-level influential approaches that make changes inevitable. That's one of the most important factors, is to make change inevitable. And we're going to unpack that and learn more about how you can actually make that behavior change inevitable for people. And if you need custom-built tools, models, strategies, and maybe even scripts to present your leadership plan with confidence, then Transform Nursing provides that in a 6-step nurse influential leadership plan workbook, which teaches you all about getting the results that you want. So if you're ready, let's go ahead and start this inclusive leadership journey today. Let's begin looking at 4 reasons why most nurse leaders fail at influential leadership. The first reason is that we want to believe that cultural competency trainings will solve incivility, and they just don't. Second reason is that we lack the confidence to lean into discomfort and have uncomfortable conversations. We're too afraid to talk about race and class and health. We're too afraid to talk about social impact, but I'm going to give you the tools that you need to do just that. The third reason is that leadership approaches don't deliver results. When an approach does not deliver results, people stop trying. So what we're going to do is work on strategies that actually will help you measure results from day one. And the other reason that nurse leaders fail is that we are not measuring behavior change, and that is exactly what we need to do. I want to ask you, have you ever been the victim of an amygdala hijack? So as we know, according to the biological processes in our brain, that the amygdala is the oldest part of the brain. The amygdala is responsible for the fight, flight, or freeze mechanisms in our brain, right? And amygdala hijacks occur sometimes when we're in places where we're uncomfortable, where we don't know what to do, and it's just a natural response. The problem with amygdala hijacks is that it blocks human connections and it keeps us from being able to engage better with one another. Cortisol deactivates all learning in the body for about 3 minutes and stays in the body for up to 3 hours. And the amygdala hijacks, like I said, throws everything into fight, flight, or freeze. But according to Dr. Zaretta Hammond in Culturally Responsive Teaching and the Brain, trust actually deactivates that amygdala hijacks and it blocks the release of cortisol. So people can actually be conditioned to engage in better human interactions. And mirror neurons also help us to understand how to respond to one another. So in this image, you see that there's a woman that's smiling at you. When someone's smiling at you, it triggers the mirror neuron, which is essential for us to learn because it helps us to understand imitation, which is the key process in learning. And mirror neurons are really important in planning our actions as well as understanding the intentions behind actions. It's possible to conclude that mirror neurons are influenced by culture and in turn have an influence on our behavior. And the results from this show that we are more prepared to understand and empathize with members of our own culture and ethnicity than those who are not. So whenever we engage in an encounter that seems a little bit different or seems like we don't really understand it culturally, our amygdala can be activated and it can produce a fight, flight, or freeze response in our body. And sometimes that looks like incivility, right? Media informs some of these things. So incivility is a process of us just not recognizing what's happening up close and personal. Right now, we know that people in this country, in the United States of America, have been victimized. Black folk have been victims of police brutality. And a lot of this is happening because we just won't see each other. So when we say that we're colorblind and we don't see something, what that's really saying to the person who's the recipient of that behavior is, I am not being seen. So saying that you're colorblind is actually, believe it or not, an act of incivility, because what it's saying is that I choose not to see you. And in many ways, you probably don't want to not see people, right? But it's so uncomfortable to talk about it. It's so uncomfortable to deal with it that we choose to be silent. And it is time for us to stop being silent about these kinds of micro injuries that are occurring and to stop the incivility. We also need to know that as the largest group of healthcare professionals in the world, at 3 million strong in the United States and 20 million strong in the world, it is going to be nurses that are going to lead these deep and honest conversations about racial bias in healthcare. Our patients are suffering when we don't practice inclusive leadership. And the reason for such discomfort by nurses is that we don't want to talk about it, but our patients are really suffering. But through inclusive and influential leadership strategy and having a skillful approach, we can deactivate the amygdala, we can stop triggering that system, and we can help promote better human connection when we practice inclusive leadership, and we have strategy around doing that. So according to this study that was done on unconscious bias, even well-intentioned providers, meaning nurses and doctors, when encountering people of color, show that they receive poorer health because of unconscious bias. And unconscious or implicit bias, you may have heard it called, are learned stereotypes that are automatic, unintentional, and deeply ingrained in our behavior. And in this figure, what it's illustrating is that the pathways through which implicit bias may affect the patient-clinician relationship and related processes. So for this instance, consider a white male clinician whose implicit bias has been activated by a clinic visit with an elderly African-American patient who is receiving antihypertensive medications, but whose blood pressure is uncontrolled. Without realizing that he is being unduly influenced, the clinician perceives the patient as uncooperative and unlikely to adhere to a more intensive drug regimen. The clinician may even erroneously remember that this patient can't afford the pharmacy copay. Consequently, although the patient's hypertension is not under control, the clinician decides not to intensify the treatment regimen. This clinician believes that he made the best decision given the situation, unaware that his perceptions were distorted by implicit bias. Furthermore, unconscious bias in general is still a problem in America today. In research done by Dr. David Williams of Harvard, he did a study to help us understand what word associations happen most commonly when someone was thought of as Black versus someone was thought of as white. And as you can see, based on these word associations, If you are Black, you're more likely to be thought of as poor, violent, religious, lazy, cheerful, or dangerous. And when you're white, you're more likely to be thought of as wealthy, progressive, conventional, stubborn, successful, and educated. So again, these biases are built into our system. Sometimes there's nothing that we really can do about it until we begin to learn how to address them. And we'll talk all about that in the Nurses Influential Leadership Lab in the course. Another important thing is intersectionality between race and health. Another way of looking at this is a tale of two Baltimore neighborhoods. Roland Park is a community in Baltimore City, as well as Druid Heights. And as you can see, based on this description, is that dying from these causes occur far more often in Druid Heights than in Roland Park. You're 3 times more likely to develop heart disease if you live in Druid Heights, 8 more times likely to develop diabetes, 15 times more likely to be a victim of homicide, and 20 times more likely to have HIV and AIDS if you live in Druid Heights. Now, these neighborhoods are separated by maybe 5 miles. These zip codes are not that far apart, but it's worlds apart in terms of the difference, and the life expectancy is also different. And as you can imagine, Druid Heights is predominantly a Black neighborhood, whereas Roland Park is predominantly a white neighborhood. The model that I'm talking about in Transform Nursing is a way to eliminate bias and to eliminate inequities. So the model that I have created focuses on 4 key aspects, which is immerse, integrate, include, and influence. We need immersive experiences so that we can better understand different groups of people. And I'm not talking necessarily about cultural tourism where you're going into an organization or you're going into a community and you're just sort of looking and observing. I'm talking about getting to know that community, understanding the needs, listening carefully to what they need. Integration requires us to think about how do we integrate social impact, racial justice into our frameworks? How do we bring health equity live in the work that we're doing? Inclusion is all that we've been talking about today. It's not so much about setting up the table and inviting everybody to come and eat. Inclusion is about setting the table together. And this is a process that, though it may seem like it's easy and simple, there are a lot of nuances to it, which you really have to break down and understand. And influence. How do we have the largest impact? How do we have social impact? How do we have personal impact? How do we motivate team building? How do we get people on board? And how do we get them ready to do the work that is required to create equity for our patients? That's what we do in the Nurses Influential Leadership Lab, is look at all of these different components. So I'm going to take you through 4 reasons why I think this course is so phenomenal, especially for nurses. The first reason is that leadership training equals accelerated advancement. The second is you will develop a leadership strategy that works. Third, you exponentiate growth with coaching, and we're going to talk all about what coaching does for us. And fourth, you will see results from day 1. That's what I really find most important, is that we really need to get results. This is all about how do we drive those results. So now let's kind of unpack a few leadership secrets that we're going to explore in the Nurses Influential Leadership Lab. The first secret, again, is that inclusive leadership actually increases revenue in organization. Forbes has actually shown that spending is on the rise for leadership and management training. People are spending up to $5,000 and $7,000, even $10,000 to go to training so that they can understand how to be better leaders, because they have actually found that inclusive leadership increases revenue. Creating high performance cultures that have skills for inclusive leadership is in demand. People are looking for people that are skilled and ready to go with this knowledge, people that they don't have to try and train, the people that understand how important social impact is to the organization. And healthcare organizations are looking for your value add in a very competitive market. So taking a leadership course of this nature is a great way to set yourself apart. The second leadership secret is that you will develop a leadership strategy that actually works, because you will be expanding on skills from bedside to leadership level. You will take what you've learned at the bedside and you will extrapolate that to great leadership skills. And I have all kinds of strategic plans, all kinds of nursing career plans that we get to pull apart, we get to assemble. You get to determine, are these the ways that we're going to sort of move our team forward? And we get to draw on tried and true business principles for greater leadership impact. I like to see what's actually worked. I look at what's actually worked for different organizations, for small organizations, for larger organizations. I look at all of these things and do a cross-sectional analysis and come up with the best principles that will work and fit for your organization. The third leadership secret is that you exponentiate growth with coaching. And in this course, you're going to learn dynamic coaching skills that you can use in any situation. If nothing else, I have learned as a certified health and wellness coach that coaching is what is going to transform the way that we interact with our patients, the way that we see them, and the way that we include them. So a huge portion of my course is all about teaching you what coaching is really about and how to do it quickly in 5-minute sessions. So I created a 5-minute coaching cue card, which I would love to share with you. And you'll get to actually practice coaching and understand how it works in negotiation between employers and patient relations. No matter where you are as a leader, you're going to have to deal with conflict resolution. You're going to have to learn how to negotiate. You're going to have to learn how to take constructive criticism. And these are all exceptional tools to teach you exactly how to do that. And I love to coach people to their greatest level. And the fourth reason is that you do see results from day one. In this course, you're going to start working on a personal success ritual for daily growth, and you're going to integrate critical reflection and awareness building into your clinical and leadership practice. The truth is that there's no one approach that's going to erase hundreds of years of systematic and deliberate exclusion of certain groups in this country and the world. It's just not. So no matter what people tell you, if they say that there's one training that's going to do it, that's just not the truth. We must not only acknowledge the systems in place, but must also be proactive in engaging in dismantling those systems. And we do this through addressing multiple levels of influence, personal, social, and structural levels of influence. And what does success look like for me? Well, I know that I have succeeded when at least 1,000 healthcare professionals and nurses complete the Nurses Influential Leadership Lab course and are not only practicing personal, but social and structural actions towards achieving health equity for all. Because what I teach in this course is how to train other people to do it. So those 1,000 people are going to touch another 100 and another 1,000, and it will be a ripple effect to the point where social impact becomes the theme in nursing schools, becomes the theme in our organizations, becomes the way that we help our patients to get to the highest level of good. I've had the opportunity to work with many amazing and phenomenal people, all the way from Trinidad and Tobago right to Johns Hopkins Hospital and University. And people have told me that I know how to guide you through difficult conversations, especially diverse groups who come from many different places and different walks of life. And I really, really like to share with you my vision for how we as a nursing body can really become the most influential leaders possible. And you may be saying, all of this sounds really great, but I have a couple of questions. You may be saying, well, aren't there other nurse leadership courses out there? Well, absolutely, there are other nurse leadership courses that are out there, but there are no other courses that are all online and are going to give you the skills and tools that you need for social impact and social justice work, which is, again, the future of nursing. Or you might be saying, this is a really big commitment. What if I don't really feel ready for this? That's okay. This really is a big commitment. Just know that I'm here with you every step of the way, and this is a peer support network. So your other nurses in your cohort are going to be helping you along every step of the way. Or you might be saying, I've been a nurse leader for a really long time. How in the world is this course going to benefit me? I love to learn from people who have been leaders for a long time. Listen, I've been at this for 13 years and I'm always still learning something new. We're constantly growing and constantly evolving. So let's be in a place where we can learn and we can learn how to lead together. Now, many traditional leadership courses are valued at about $5,000 when it comes to leadership and management and when it comes to training. But I wanted to make this as affordable as possible. So there are two different options for this leadership course. You can either pay monthly in 12 incredibly reasonable monthly installments of $97 a month, roughly the cost of a $4 Starbucks cafe au lait, which is one of my favorite beverages. Or you can do a single one-time payment of $1,000, which saves you $164 right away. And I'm going to go through all of the wonderful bonuses that you get as part of this course. The first bonus is that you get 12 CEUs. This course is an accredited provider of 12 continuing nursing education units by the American Nurses Credentialing Center's Commission on Accreditation. I'm super excited to be offering that to you. It's going to be phenomenal. The second bonus is that we get a course roadmap master plan, which shows you exactly how to get through this course in 3 months if you want to, step by step, week by week, itemizing exactly what your homework assignments need to be, how you can structure, how you can get through it quickly and efficiently. The third bonus is that you get the Insiders Club private Facebook group where you get access to me. If you have any questions, we go over assignments and lessons. If you're hung up on things, we learn together and we build together. And that's the organic, beautiful part of this work that we're doing. The fourth bonus is that you get one-to-one master coaching sessions with me. I will personally sit down with you or on the phone with you, work with you through whatever organizational plans that you're working on, work with you on any career moves that you're working on, help you to get to a place where you feel that you're confident in presenting this to your organization and making this a part of your organizational culture. The fifth bonus is that you get live online conversations as well, because we are definitely unpacking some deep and very challenging work around racial justice and around social impact. And this can be really heavy, and it's good to have a community of people that you can go to that can share with you what it really means to have people that can support you. And it's great to have that option. And I haven't seen any other online course that's really offering that. So I'm really excited to be able to offer that. The sixth bonus is that you get this network of innovative nurse leaders, right? You get peers, you get mentors. And one thing I have found in nursing is we cannot get enough mentors. Had it not been for the mentors that I've had, I would not be in the place that I was today. Mentors help you to get to where you're trying to go quicker. So you don't have as many pitfalls and don't have as many places where you're having issues. And this network of nurse leaders are people that are going to be with you for the rest of your career journey. So it's just powerful to have that. And the final bonus is that for a limited time, you will actually get this 6-step nurse influential leadership plan workbook when you sign up for a coaching call with me. So I'm offering you right now a free 15-minute coaching call so we can talk about what your goals are to really create leadership in your organization, whether you understand inclusive leadership or not, whether you understand influential leadership or not, whether you're starting out, you're in the middle, or you're at the end and you need that extra momentum to just push your way through. I am here to do that for you. So check out the link that's in the webinar. It's also right here. It's transformnursing.com/consult. And you can schedule that 15-minute session with me and we can get started talking about the change that you want to make in your organization. I want to say thank you so much for taking the time to really shut down everything else and really focus on being intentional about creating social impact in your organizations.